Hello, fellow pain sufferer. If you're like me, or should I say like I used to be, you're suffering with pain, numbness, or even loss of strength or function. Maybe it's tendonitis or joint pain or even a herniated disc. I've had them all. I've blown my lumbar disc on 5 separate occasions. The first 3 I went through back surgery, a laminectomy, a discectomy, and even a percutaneous discectomy, which is a microscopic surgery that scrapes the disc away from the nerve of the spinal cord. Now, after the neurosurgeon operated, he told me that he hadn't even had much hope that he was going to be able to help me because my back was so torn up. Now, that would have been nice to know before cutting me open. Finally, it worked, fortunately anyway, and after another 1.5 months of continued pain that ran down into my cheek and my left leg, it finally calmed down and went away. In fact, the surgeon wanted to take me with him to Switzerland to show off his handiwork at one of his conventions. Now, I didn't take him up on it because it seems like every time I go on this long plane trip, another disc will blow. Now, I didn't understand why my disc kept blowing when I took such good care of myself. I exercised and even got regular chiropractic adjustments, but that's another story. But let me just say this, if you have mercury fillings in your mouth, you need to get them out. When my disc blew a 4th time, I was ready for it. I had installed 2 spinal decompressions in my office, along with a neuromuscular reprogramming machine called an ATM, which stands for Active Therapeutic Motion, not the one that dispenses cash. Those helped restore me to normal the next 2 times my disc blew, but the last disc bulge did take out the remaining motor function I had into my left leg and foot. That left me with a permanent drop foot. I did have a previous mild drop foot that had gotten increasingly worse every time I blew a disc, but years later my neck went out. Now, I have a history of multiple neck injuries as well, and the arthritis had slowly built up, causing my arms and hands to go to sleep at night. Then one morning I woke up and tried to massage the feeling back into my hands, but this time it didn't work like it had in the past year or so. Now, I had permanently lost the feeling in 3 of my fingers, 2 of my fingers and my left thumb. But what really scared me was when I noticed I was starting to lose the strength into my left arm, chest, and back muscles. So I got on the cervical or the neck spinal decompression machine, and I tried that for about 3 weeks, which was normally plenty of time for my lower back to start feeling some relief when those discs blew, but nothing. I was getting even weaker in my left arm and chest, and the numbness was becoming more pronounced. I tried laser therapy, PEMF, which stands for pulsed electromagnetic field, which I've helped many patients with to eliminate their pain and repair joints by stimulating their stem cell growth. Even our famous HACOMed, which is an incredible machine that I'm going to tell you about on this site, which stimulates and improves the function of damaged nerves. It slowed the progression of my numbness and loss of strength, but still no improvement. I even tried the Rebuilder peripheral nerve stimulator, which I've used to help many of my patients with peripheral neuropathy, which is a numbness, pain, or a burning in their feet or their hands. Again, it kept the nerve alive like the HACOMed was doing, but I wasn't gaining any ground. But what really killed me is when I had to give up golf. Every time I grounded my club out, it would shoot this zinger into my left arm, and then my neck would hurt for the rest of the day. I knew I was in trouble and was looking at surgery again, along with the 3 to 6 months recovery time that it takes to fully get back into practice. Now, that could have easily ended my career in bankruptcy, but I knew if I didn't do something fast, what was going to follow. Right then it was only affecting the sensory nerves with numbness, but if it collapsed on the pain sensory nerves, I wouldn't be able to function. And back when my 4th lumbar disc blew, it took out all the remaining motor nerves in my left leg and foot, leaving me with a permanent drop foot. If that happened to my arm and my hand as a chiropractor, I'd be finished. There's not that much of a market for a one-arm chiropractor. So I started to schedule an MRI to get the whole surgical process started. Now, I remember praying, asking God to help me, with what I couldn't fix myself. And that scripture that says, "Physician, heal thyself," that came to mind. Now, it couldn't have been a day or later or so that I remembered a company that I used to work with years ago. They utilized traditional Chinese medicine to get results for patients when nothing else worked. In fact, they had saved my career years before when I was suffering from tendonitis in my elbows, so bad that I was considering taking off some time to try to let them heal. I don't know if you've ever had severe tennis elbow, but it makes doing anything with your hands extremely painful. As a chiropractor, the constant explosive stress on the joints from adjusting was just too much, and I tried ultrasound, icing, electric stimulation, anti-inflammatories, straps and braces. I'd even let my medical doctor give me a couple rounds of steroidal injections, which helped a little bit the first time, but only made it worse on the second round. So I grasped at one last straw, which was this company that promised to heal chronic tendonitis in as little as 7 days. So I tried a series of their patches, 3 in total. The first one decreased my pain by about 50%, the second by about 75%, and by the third, which took a total of 8 days, was completely healed. It had, in fact, though, healed by day 7. I just left the patch on the extra day to get the full benefit. Now keep in mind, I hadn't missed a single day in practice, and it's never given me a problem since. And that's the amazing thing about these patches. And in most cases, you can continue with your normal activities within moderation, of course. That's because the Chinese herbs in these patches act like heat-seeking missiles attracted to inflammation. That's why you don't want to use ice or anti-inflammatories when you use these patches. It hinders their effect. In fact, if you can apply heat to the patches, it enhances their effect. And it allows the herbs to penetrate faster and deeper. Well, I was so thrilled with their product that I had to find out more about them. They had products that repaired damaged discs, osteoarthritis, allergies, asthma, COPD, cancer, almost any disease you could imagine. Diseases that are typically considered untreatable. But many of their treatments required equipment that I just didn't have, like the spinal decompression table or acupuncture. So when I tried their patches on my back, when I blew a disc shortly thereafter, I didn't get the relief I had hoped for. So for whatever reasons, I had forgotten about the company until my recent neck problem. But this time, I had the tools. I was able to use the patches and a product called LC Balancer, which improves the microcirculation of the small arteries and improves the lymphatic elimination of all the waste and the dead tissue. Along with what I had previously been doing, I was finally seeing improvement. About 5 patches later here, and I was beginning to feel the dead numbness in my arm decrease and the fingers slowly regaining sensation. By day 16, the feeling in my left hand was completely restored. My arm and hand slowly came back to life along with my strength, and by day 22, I was back on the golf course. If you have a sport that you love to play, you know how difficult it is to give it up. Now please understand, my recovery was a little faster than most because I have the equipment that I was using on a daily basis. But I can still offer this to my own patients 4 days a week along with the Chinese herbal treatments. So I'm not just a doctor that helps others with acute and chronic conditions, I'm also a patient. And I'm not saying I can help everyone with every single condition out there. Obviously, I can't fix a severed nerve resulting in drop foot, but with the products and the equipment and the training I have in chiropractic, functional medicine, functional neurology, and energy medicine, there aren't too many different conditions that I just can't help with. And if it's just pain, if it were legal, I would guarantee I could help you with an 80 to 100% improvement. But if I made that promise, I'd have the FDA and the chiropractic board busting down my doors. We're not allowed to make guarantees about anything. But to give myself a little more credibility, you can read about the science, the equipment, and the testimonials of just a few of the thousands of testimonials of patients and doctors who've experienced success with just a fraction of the technology and the training we have in this office. After you check it out, if you have a condition you'd like to find out if I can help with, give us a call to schedule a free consultation. If you're out of the area, we can do this on the phone or by email. If it's something I can't help with, I won't pull your leg. I'll let you know right up front, and it won't cost you a thing. But if you don't call, and that it is something that I know I can help with, you could be passing up the chance to run, play, golf, enjoy relationships, continue working, or whatever it is that your pain or illness may be threatening or has already robbed you of. But don't wait. If your pain is chronic, it's likely only going to get worse. And the longer you wait, the more it's going to take to fix it. And this free offer may not be around much longer. And I hope to talk to you soon. God bless.